Interesting. No, it's cool. It's coveted. It's like a cool thing. It's a cool thing. It's fine. Okay. When will Mahesh tell me this is on? All right, cool. Okay, so we have, yeah, let's do it. You can also get that thing on you if you want. Mike. This is a patient with pancreatic cancer, intractable pain, doing a celiac plexus block. All right, so this is the pancreas looks, it's pretty bad, atrophic, dilated duct. So you're asking me, right? So where am I going to go in this case? Yeah, so this is the aorta and the celiac artery takeoff. Uh, Let's see. Yeah. So this is AO and celiac artery. Yep. And these here, what I mentioned to you, are the ganglia over there. This little small hypoechoic structures here, these are celiac ganglia, right there. So whether you should target the ganglia or not is a question.
So it is extending linearly also, like when you trace it, like it's going.
What is? So ganglia neurolysis was a thing, and there was a consideration that it works better. But then there is one not very well conducted study which shows that it reduces the increases mortality or reduce survival with celiac ganglia. So that's why people got scared and stopped doing celiac ganglia. So I'm not sure whether there's a lot of truth in that. But anyway, I don't care much about ganglia. Anyway, in this case, it's so small that I wouldn't even bother. As far as where to go, obviously, the most important thing is avascular area. Because there are some really sensitive vessels here, and you want to avoid
Major
those.
vessel like aorta?
Certainly, aorta, celiac artery, but then there is a left vertebral artery and stuff. And that can be a real problem, right? So, I mean, those are all catastrophic complications. So that's why you have to be very careful. This is one of the sort of
Risky
procedures which I have during my event training days. I was always a little apprehensive of these cases. Touchwood, things have been okay so far, but I always, want to be extra cautious in this sensitive area. Coming to think of it, IR guys do it under X-ray guidance it's too much for me. I'm like, with this also I'm scared. They do it under fluoroscopy, half centimeter left of this and put a needle and inject. So, I mean, that's a little too much. So you can go at the base. So when you talk about that, this is aorta, celiac artery, and then you do at the base, which is over here, okay? But base is not great location in this case, because you can see there are these vessels here. So then you do a by on the sides. So when I say on the side, you do a little counterclockwise, clockwise rotation. So this is the side of it. So you go here, right? One side. And then I'm going to go clockwise and maybe do somewhere here. So it is on the other side of it. Okay, somewhere there. So there's a bunch of vessels, so be careful. Base is where I usually go. I do see a couple of vessels. So I think I'm going to go a little bit on the left side, avoid this particular vessel, and then go about this area. This area, it's below the diaphragm, right? And this is at the absolute vicinity of the celiac artery area, and this is the ganglia over here. Okay.
So are we going to puncture the diaphragm also?
No, diaphragm is proximal. Okay. So we are using a 20 gauge CPN needle by Cook. And yeah, okay. Hold the scope, please. Ma'am, you can just make a note of the heart rate. Are you okay? Something fall? So, I mean, I don't like to use the elevator much, but I may have to use a little bit of elevator here. Yeah, okay. Yeah. Okay, lovely. So I'm in a very good position, I feel now. Yeah, aspirate, please. So we're going to aspirate first. There's no blood, right? Stop. Okay. And then picture there. Yep. Okay, good. And I'm in the right spot, absolutely where I need to be. I'm going to hold the needle. Now press. She needs to feel it's supposed to be hard. It's not going to be easy. Is it hard? Very hard. That's a good suggestion. I mean, that's what you want. A hard push. It should not be very easy to push the medicine. It's a tight space, so yeah. Not seeing the bright echoes that I usually would expect. Okay, good, very good. What I'm going to do is, considering that on base and on the other side there are vessels, I'm just going to put all of it in this side. So we would call it a unilateral CPN here.
Unilateral near the base.
Yeah, I mean it's almost on the side of the base one, this only. Okay, keep going.
I think 50% of
Stop.
alcohol, 50% of bupivacaine.
65 is fine, but it's
Okay, go ahead.
100% alcohol. So what
98% alcohol.
Absolute alcohol is 100% alcohol.
98% or
98% alcohol and
bupivacaine
bupivacaine.
10 ml.
10 ml, 10 ml each.
Yes.
It's 20 ml.
So I was looking for the bright stuff and where it's gone. Like this is where you see this. This is all the injected. You see here? This is the injected. Oh, is she? Okay. Okay, that's fine. So this is where the injected is gone near the base. All of this
Mix
is the
करायचं की एक
injected.
वेगळं एक वेगळं.
So it should be good.
Because 5 ml हे घ्यायचं,
Should be
5 ml
fine.
हे घ्यायचं.
Like that. Perfect. So what you expect is if you have hit the right spot. Hi, can you take this? If you have gone the right location, first when you go to cardiac as the little more pain, and when you increasing heart rate during the procedure, those are things that do imply a better success rate and do imply that you are going the right spot. And they may have a little diarrhea from the sympathetic nervous system. And then you see how it works. Now it's going to reduce the pain, cannot completely ablate it, but realistic expectations of what to expect. It may reduce the pain, will not take it away completely. Opioid requirements will reduce. Those are the things to expect. Okay, good. We're done there.
Can I?
So, yeah, of course. Come. All right? Okay.
एक वॉस्पिस देना ड्राई.
See the medicine floating? Right? So, all medicine here, this is celiac artery. Perfect. Great. Thank you. इसको निकाल देते हैं.